It is looking more like a COVID-19 vaccine could be ready soon, but then getting that vaccine into the arms of Canadians is an entirely different challenge. Since 2 doses are required to achieve protection, 75 million doses of a potential vaccine will be needed in order for every Canadian to be vaccinated. Infectious disease doctor Gerald Evans is joining us this morning to talk about some of the challenges that we'll be facing when distributing a COVID-19 vaccine here in Canada. Good morning to you.
Good morning, Anne-Marie.
The numbers that we heard yesterday show that we may not be getting 75 million doses of the vaccine at once. In fact, according to Ontario's health minister, the entire country is expected to receive 6 million doses in the first part of 2021. How are authorities planning to decide then who to vaccinate first?
Yeah, well, this has been one of the major challenges right now is to sort of look at, who should get the doses first. And I think if you look at what has been discussed, and there was a recent paper published in the CMAJ that talked about the idea that vulnerable people who are likely to suffer the most in terms of consequences of COVID-19 would certainly be on the top of the priority list. And then the other group includes healthcare workers, just simply to make sure that we can maintain the healthcare system while we continue to fight COVID-19 with the rollout of the vaccine.
That's government numbers, but I'm curious about private companies. Will they have access to the vaccine, and could they potentially buy large doses, let's say, for example, if they wanted them for their employees?
It's a great question. I would think right now, although the regulatory approvals process is moving along concurrently and quickly, I think there's going to be some control over the ability of, say, a private corporation to try and obtain doses. The company is going to have what really is essentially a license to market, but it's going to be tightly controlled, just simply because, as you point out, there are going to be limited doses during the first initial rollout.
When the full slate of doses does become available, will we have the proper resources and infrastructure in place to be able to distribute them equally? And what facilities could we be looking at for doing that?
Yeah, that's the big question. And I know there are efforts at the moment going on across all of the provinces. There is actually a group, I know, of pharmacists who are busy working on a sort of mapped out plan for different parts of the country to ensure that they take part in that process. So I think we're going to be looking at administering this vaccine very quite similar to what we've done with flu vaccine. So it's going to be available to clinics, to pharmacists. There will probably be public health units setting up vaccination clinic areas and units to be able to administer it to the high-risk populations. Hospitals are going to be involved. I think the entire network that we currently have to try and roll out vaccines, somewhat similar to what we saw in 2009 with the pandemic H1N1 vaccine.
Pfizer's vaccine requires storage at -7 degrees Celsius. So how will this factor into distribution?
Well, it's an important one because you have to have the ability to store the vaccine once it rolls out to different regions around the country. And we're going to have to address the issue of remote communities in Canada and the ability to have that round. -70, -80 freezers are pretty common in some larger hospitals, certainly in research facilities where they're used. So there has been a big buy already going on to companies that make these freezers in order to accommodate the Pfizer vaccine. But the other issue is that the Moderna vaccine, a similar kind of platform with mRNA, doesn't require as extreme cold storage as the Pfizer vaccine, and it may be that that vaccine is going to roll out to places where the ability to refrigerate at such a low temperature isn't available.
All right, Dr. Evans, good to have you on this morning. Clear some of that up for us. Thank you.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.